E10 Hotel, Rennie Sean. Welcome and peace. My name is Sean. I'd like to thank everybody for tuning into this episode of Science with Sean. We are in the building. Um, do want to go over a recent study that was published, and most people aren't aware of this, but they're always doing studies, and they're always trying to update the information and educate people to make sure that they got the right stuff. So I want to rehash something that I've gone over and over and over and over and over on numerous shows. But I really want to drive the point home because of this recent data that has come out of regarding this conversation, this topic, and just not to give anybody any wiggle room. So, in the description of the video, there's going to be a host of sources that will be revealed. I know that YouTube is not sending out notifications for some reason. Well, I didn't get a notification. So my phone didn't light up. So I know I'm pretty sure that other people did not as well. So please like the show, share the show, tell a friend that we're actually live, and then we'll get this bill going. I do see you in the chat, Sister Benita. Please like the show, share the show. Hold on one second. All right. And I see you, Brother Lavelle. Peace to you, good bro. Hey man, we still you still want to do that interview or nah? What's up with that? What's up with the interview? Can we get the interview? Can it be done today? Can it be done tomorrow? What's up? What's up? I can't do it tomorrow. I gotta work. Let me know, man. Let me know. What up, EIE? See you new in the building. Like I said, man, a lot of people don't know that we're actually live. So I'm trying to let some people get in the building before we actually get there. I don't know if somebody else is live or what they got going on in their world, in their metaverse. But please like the show, share the show, and tell everybody we in the building, man. You know what I'm saying? Share it on your social media sites. I want to kind of drive this point home, so I'm taking my time regarding the subject matter. Okay. So I don't just jump out the window already when I know I'm trying to get some more people in and we deal with this topic. You've been what? Been trying to this convo about myocarditis. This we've already done shows on this. What you mean you trying to have a conversation about it? We already did shows. I did a presentation on myocarditis a long time ago. Twice. Because two people kept bringing it up. We'll try to shoot for like Friday evening or something like that. If that's cool, Brother Lavelle, just hit me up on Facebook and we'll book a time. Yes, I did. So let me go ahead and debunk Anusha real quick, y'all. She won't smoke already. She gonna tell me what I did or didn't do. So let me share my screen real quick. It's just for fun, so don't take it personal. We're just trying to let some more people get in the building because we are live and I don't think people getting a notification at all. All right, so let's go. Science with Sean. Let's go to videos. All right. Let's see if myocarditis comes up at all. I'm going real slow. The Case of Myocarditis and Dr. Mendel Singer. That's one. Risk of myocarditis from COVID-19 infection in people. That's two. I can flip to the Mossy and see if there's a third or fourth. So there's two here. See how you get them out of there real quick with that. Get out of there real quick with that. Boom, boom. Bye, bye. Man, where everybody at, man? Y'all scared? Y'all busy this Saturday? Who else live? Somebody else live? Somebody else live? Yay, nay, no. What y'all think about that thumbnail, though? That thumbnail dope, ain't it? I just put that together right before the show. Like, it took me like a couple minutes. Boom, 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 boom. Graphic it up and all that. Yep. Myocarditis risk versus reward. Yeah, man. Like that, share that. It's cool. If it ain't, apparently we got some people that hopped on and hopped back off. So, that's cool. Hopefully, people checked out the Mashawari clan. Science fiction is the archaeology of the future. Present bill with brother on Kung Fu and Black Panther. It's pretty interesting. If you hadn't checked that out, man, make sure that you go over there and you tap into that. Boosie says he's the fluffy king. He ain't the fluffy king, man. You might get some attention though. But you ain't even got number one fluffy, Boosie. And you cried about the price. I like Boosie though. He funny to me. Straight comedian. All right, so again, yeah. We're gonna get to it real quick, man. Yeah, you crazy. Hold on just a second for me. Now, after I do this, I guarantee you that people are going to bring this subject matter up again, and they're not going to want to watch the video. So, for those of you who might come into contact or in the conversation with people that are having these dialogues or whatever the case may be, you just make sure that you send a video to them and you just let them know, hey, tap into that. You know what I'm saying? Because that's pretty much all you could do at this particular point is you could do that. Now, I think Chavis, I know his kids had a game today. Should have asked about that. But he ain't said nothing yet. So I guess they might have got smashed. Indonesia said he was just reading about it. Depends on what you was reading. First of all, shout out to Spence Kimball. Spence Kimball, he been on this same subject every month. He been talking about this subject every month. He's a researcher for NBC regarding this particular topic. You know what I mean? So he's been doing a good job of following the conversation. However, there's some information that I think that he should have included in his last article that he published regarding the myocarditis conversation. And I see we got a few more people in here, man, and that's what's up. So we're going to go ahead and we're going to really get to it. You know what I mean? I ain't looking for I know I ain't getting 50, 60, 100, 200 people in here when I'm talking about whatever I'm talking about. But if I change the title and I word it in a certain way where it's clickbait, you know what I'm saying? People will come in for the drama. Unfortunately, the drama is dead. It might be on another channel though. I might get some drama in here when I do that Jabari bill. That'll have people gushing. All right, so let me go ahead and share my screen. Everybody should be able to see my screen. You know, I put everything together for myself. You know what I'm saying? So if you see this and you take a look at it and you like, dang, it's dope. You know what I mean? It is what it is. It is what it is. So myocarditis risk is higher after COVID infection than after vaccines. Let's see if that's a reality. So here's the outline today. And these are the things that we're going to talk about. You'll see my introduction, definition, research questions, hypothesis, argument, conclusion, and sources. All right, so introduction. Myocarditis has been a topic of conversation for some time. This lecture will look at the most recent scientific data and determine whether we should be more worried about a vaccine causing myocarditis or natural infection. It's my hypothesis. People are under the assumption that myocarditis is more prevalent in vaccines than in natural infections. I believe this is due to the fact that conspiracy theorists push this agenda after a rare incident that transpired in those 6 women who had taken Johnson & Johnson's vaccine. After that incident, as rare as it was, the anti-vaxxers continued to keep this rare case a primary focus in their talking points. I do want to add to this the fact that myocarditis was first spotted in vaccinated military people in a certain age group. It was rare, few days, they was fine. So they knew of the cause when they first started administering it to frontline workers and military. They were the first ones to basically report on the subject matter. However, no one in that earlier onset developed any long-term issues or died. So here's my research questions. I kind of did it reverse. I usually put my research questions out there first, but I kind of did it in reverse for a reason. However, what is myocarditis? What causes myocarditis? Is myocarditis more prevalent in vaccinated individuals or people that are naturally infected? And I can see that the R went off the screen here. So here's a definition of myocarditis. And as you can see the heart moving in the background, that should be a great illustration for you. I'm going to play it again for the people that are tapped in and like the graphic. So myocarditis is an inflammation of the heart muscle. The inflammation can reduce the heart's ability to pump and cause rapid or irregular heart rhythms. Yeah, I know y'all like that. Now, infections with a virus usually causes myocarditis. I'm going to repeat that again, and I'm going to come back to that later on. Infections with a virus usually cause myocarditis. Sometimes myocarditis can result from a reaction to a drug or be a part of a more general inflammatory condition. Signs and symptoms of myocarditis include chest pains, fatigue, shortness of breath, and rapid or irregular heartbeats. Now, in February, the CDC Advisory Committee met on immunization practices to debate the risk of developing myocarditis after receiving Mrna or Pfizer's vaccine. Though rare, Pfizer and Moderna's vaccines have both been linked to a risk of myocarditis. However, the risk was higher following the second dose of Moderna's vaccine in people's ages 18 to 39 years of old, according to the CDC's safety surveillance. Now, the risk of myocarditis after COVID vaccination is highest in teenage boys and young men following the second dose of mRNA vaccines, the technology used by both Moderna and Pfizer. Symptoms develop within a few days after vaccination, including chest pain, shortness of breath, heart palpitations, and fatigue. The risk of myocarditis after COVID vaccination is highest in teenage boys and young men following the second dose of mRNA vaccines, the technology used by both Moderna and Pfizer. So symptoms develop within a few days after vaccination, including, I'm having to reiterate this, including shortness of breath, heart palpitations, and fatigue. Although it is rare, they both have been linked to the risk of myocarditis. I want to make that point clear. I too slighted it to make that point very clear. So it has been linked, and we know this now. All right, we should know this. So what is really going on now? Oh, hold up, I went back. My bad. Now, for every 1 million second doses administered, Moderna vaccine recipients had 10.7 additional cases of myocarditis and pericarditis over people who got Pfizer, according to the study. The difference was even higher in men, who experienced 21.9 excessive myocarditis and pericarditis cases with Moderna shot, while women had a 1.6 additional case. So this situation is more prevalent in men than it is in women. Women are less likely to experience myocarditis per 1 million second dose shot administered. Now, the overwhelming majority of people who had myocarditis after COVID vaccination fully recovered, and most reported no impact on their quality of life, according to the CDC survey of cardiologists and other healthcare providers. The survey found that 81% of their patients developed myocarditis after vaccination completely or probably recovered within 37 weeks after their diagnosis. Another 15% had improved, while 1% had not gotten better. Most of the patients, 83%, had restrictions on their physical activity after their myocarditis diagnosis. However, 39% still had restrictions at the time of their survey. Physicians recommended that people who developed myocarditis avoid vigorous physical activity for a few months to make sure their heart fully recovers. The CDC said males ages 12 to 39 years old should consider waiting 8 weeks between the first and second doses of Pfizer and Moderna's vaccines. Public health authorities in Canada found that the risk of myocarditis is lower for younger men when they wait 8 weeks. The risk of myocarditis is low after vaccination. U.S. health authorities have said COVID infection poses a higher risk of heart inflammation. Let's see. Now, the potential causes of myocarditis include viruses, bacteria, parasites, and fungi. But we're going to focus on the topic of conversation, and that is viruses. More specifically, Sars Cov2. Now, many viruses are commonly associated with myocarditis, including the viruses that causes the common cold, COVID-19, hepatitis B and C, parvoviruses, which causes a mild rash, usually in children, fifth disease, and herpes simplex virus. There you go. So there's a list of viruses that actually causes myocarditis. Now, myocarditis or pericarditis are much more likely to follow infection with SARS-CoV-2 compared with COVID-19 vaccinations, according to a research published today in Morbidity and Mortality Weekly Report. All right. So we're going to take a look at the data that supports vaccination regarding this subject matter. Peace to everybody that's sliding in here a little late. Now, the study was based on electronic health records from 40 U.S. healthcare systems from January 1st through January 31st. 40 U.S. healthcare systems between the 1st of January to the 31st, all related to heart conditions following COVID-19 infections among a stratified age group of 5 to 11, 12 to 17, 18 to 29, and people that are less than 30 years of age, pretty much. The rates were compared to documented cases of cardiac conditions following 1 and 2 doses of mRNA vaccines. The incidence of cardiac outcomes after mRNA COVID-19 vaccination was highest for males between 12 to 17 years old after the second dose. However, within this demographic group, the risk of cardiac outcomes was 1.8 to 5.6 times as high after SARS-CoV-2 infection than after the second vaccine dose, the authors wrote. So natural infection was 1.8 to 5.6 times higher than after the second dose reportings. Let's be more specific. For boys ages 5 to 11, the incidences of myocarditis and myocarditis or pericarditis were 12.6 to 17.6 cases per 100,000 after infection. 0 to 4 cases after the first vaccine dose. 0 after the second dose from the ages 5 to 11. So children from 5 to 11 don't experience myocarditis after the second dose. Is very unlikely per 100,000. However, there were 12.6 to 17.6 cases reported after infection. So it was greater after infection in that age group. Now, the numbers shift substantially for males ages 12 to 17. Now, in that group, the incidences of myocarditis and myocarditis or pericarditis were 50.1 to 64.9 cases per 100,000 after infection. So 50.1 to 64.9 cases per 100,000 after infection. It was only 2.2 to 3.3 cases after the first vaccine dose. Now, following the second vaccine dose, it was 22 to 35.9 after the second dose. Far less than the infection again. So we have supportive data that would actually insinuate between those three age groups, everybody below really 30 years old, that infection was greater than the vaccine. This is the scientific data. Now, though cardiac complications following either natural infections or vaccination were rare, they were much more common in males compared to females, and in teens compared to older adults or younger children. The authors say the findings support the continued use of mRNA vaccines. Now, before I go further, I want to go back to a slide here. Where you at? Should be right here, slide 14. All right. So, knowing what we know now after this study, another study was cohesively working at the same time, and this is the information that has gathered that says there's less risk of myocarditis following the second shot if we had children, or if we had people from 12 to 39 years old wait 8 weeks between the vaccines. More specifically, men, young adults, and male children. So boys, young adult males, and adults that are less than 40 years old should wait 8 weeks between their vaccine doses. Now, there's another benefit to that hasn't been, that did not even be mentioned in the studies, and that's a robust immune response. That means your your antibody buildup is going to be a little bit greater. Yes, they found that more common in the elderly in that Pfizer study that they did overseas, but that's also more prevalent in pretty much every age group that time apart. So I wanted to come back to slide 14 and stress that. Now let me continue. If there's anything wrong with this whole thing, it is that option right there. Just clicking. All right. So conclusion. I conclude based on the available data and the most recent study that the mRNA vaccine is less likely to cause myocarditis than the actual virus. This notion that vaccines are a higher risk has been refuted with evidence since the very first reported incidents after the death of 6 European women. Here are my sources available to you guys and ladies. And there are some more sources for you. And they are also in the description of this particular video. So no, there's not a lot of data pertaining to this actual buildup. It is, but it isn't. It's not even required to actually flood that presentation with a lot of information, to keep it short, sweet, and compact. Something that we can digest, build on, and move forward. As summarized in my conclusion, and when I went back to slide 14, myocarditis is more prevalent in males than it is in females, and is below people below the age of 40. And if we space out those vaccine doses, we extend them a few more weeks out, the likelihood of experiencing myocarditis is less likely. Even if you follow the regular vaccine schedule, you're more likely to not have a response. It's pretty much like a 50-50 thing. As you saw the data show, but natural infection was 50 to 64% times the rate of that of after the first dose, which is real low, less than 5 times, or 20 times after the second dose. So there's that likelihood that you want to get into to deal with that. So people bring that conversation up regarding myocarditis. You're more likely to have that inflammation of your heart transpire with natural infection than in vaccination. So that's the science, and that's where it stands up. And anyone who wants to view the studies, they're in the description of the videos, and the contributaries are also sourced in the information. There should be a total of 6 sources available to you, not only to educate you on myocarditis, but the 2 most recent studies. Well, yeah, the most recent study because science is always answering questions. And those are the things that we would like to focus on wholeheartedly. So I hope that in that bite size 15, 20 minutes, you've actually learned something from this conversation today that you can build on. Although we've done this before, we continue to break barriers and make sure that the pseudos.
Hold up! You gonna get this work! You gonna get this work, nigga! I killed you. Hold up! You gonna get this work!
So our job is to make sure that these pseudos get this work. And that's what we're going to do. So I appreciate everybody for tuning in. You know, like the show, share the show, tell a friend that we were live. Make sure that you subscribe to the Mossy Warrior Clan YouTube channel, Science with Sean, and Kofi Pi Psi Research Team. Look for and assess you and a SARS channel as well. Make sure that you're looking forward to information or presentation coming from Sutek Akande regarding something specific in West Africa. And it's going to be a nice little bill. And stay tuned for that. And also stay tuned for our conversation that we're going to have. We're going to have an open book. We're going to have an open book build on a book that we're reading. So, we're going to be informative about it. I asked him, I said, hey, let's do this live. And, I asked him, has he thumbed through the book yet? So I'm trying to give him time to kind of thumb through the book, get it under his feet, and do all of those things. And then we're going to bring a lot of solid information to you guys. And hopefully it's well received. Wake up! So, yeah, that's what we're here to do. We're here to make sure that y'all wake up, and we're going to drop them bombs on y'all the way that we need to drop them bombs on y'all so that everybody is abreast to the actual topic of conversation and learn, as Kofi said, as I learn, we all learn with it. And on that note, man, y'all got y'all Saturday back. Too legit.